Okay, going back to where I left it off. So diagnosing gets a little bit more tricky when, obviously, in the case studies that I gave you, as well as in real life, you can a client sometimes meets criteria that falls within more than one diagnosis, and that is absolutely fine. However, for your mental sanity, and because this paper has a page limit, if you think the case study that you choose, your client meets criteria for more than one, more than two, just focus on two diagnoses. I think this is going to help you focus and be more um, coherent in your story. And what I want you to do is the following to simplify your work. First, you're going to use as your first diagnosis the one that you think best describes the symptoms that, or problems that your client is experiencing. The client in the case examples that I give you, um, and also choose the one in which you see for which you see your client meets the most number of symptoms or problems with. In other words, where you feel your client checks the most boxes. Um, that's the first part. The second part, if you then decide to select the second diagnosis, what I would ask you to do is to just explain very briefly why you ruled out that diagnosis. Ruling out, for those of you that haven't heard that word, means that you consider that diagnosis, but for the time being have decided not to use it. Um, you could ruled out completely something because you have enough information, so you can write it in the past tense as ruled out, or you can write ruling out, which means that as a clinician you still need more information before you make a decision. So because in this paper we have a limited amount of information, I would encourage you to maybe use the present tense ruling out, um, and then in there quickly justify why is it that you considered that second diagnosis, and why is it that you then decided to discard it. Like, briefly explain your choice in a sense, right? Well, Professor Diana, my client could potentially meet criteria A, B, C, and D for this other diagnosis, but in the end, I decided not to use that diagnosis because he doesn't meet enough criteria, the onset is not adequate, the duration is not adequate, whatever it is that helped you in the decision making process to rule out that diagnosis. And that's all I want you to do. Where I want you to go in depth with describing um, the whole process is with the first diagnosis that you choose. Now, bear in mind that maybe you decide not to give a second diagnosis, and that is absolutely um, okay. I'm only giving you that option in case the case study that you choose, you are torn between choosing one or two diagnoses, because that's what really happens in real life. A lot of the times we still don't have enough information. Even when we do, clients still meet criteria for more than one diagnosis, and we just have to prioritize which set of symptoms and which diagnosis we're going to be working first with, because a lot of the time, as you can see, some diagnoses can coexist. And that is my final point on the issue of diagnosing. One thing that I want you to keep in mind, if you go to DSM 5, and even if you do a quick search online, you're going to see that for some diagnoses, there are some diagnoses cannot coexist with other diagnoses. I'm going to give a random example. Oftentimes, if you diagnose a client with conduct disorder, an adolescent with a conduct disorder, then there are certain types of diagnosis which may not be able to coexist with that diagnosis. So, a client with conduct disorder may not be able to be diagnosed with, I'm making this up, it doesn't mean it's totally true, like oppositional defiant disorder or ADHD. So for each diagnosis, DSM-5 lets you know with what disorders your disorder can coexist and with what disorders it cannot coexist. So that's called comorbidity. So if you do a quick search, if you don't have the DSM-5 available, if you do a quick search, maybe you can type in with what diagnosis can oppositional defiant disorder be comorbid with, or with what other diagnosis can you diagnose oppositional defiant disorder or conduct disorder with. It will kind of give you an idea what are the diagnoses that you should consider and what are the diagnoses that you should not consider. And I think that's also going to help you in your ruling out process for those of you that are thinking of giving more than one diagnosis. That might be also part of your justification, right? Professor Diana, the DSM-5 suggests that clients that meet criteria for this disorder cannot be diagnosed for this other disorder. Or I'm thinking about diagnosing this because the DSM-5 suggests that indeed clients that are experiencing this disorder can also experience symptoms from this other disorder. So that's basically how you do diagnosing and differential diagnosis. I am hoping that that will clarify it for you. Also, I have included, I think, enough information in the first 2 or 3 modules regarding differential diagnosis and things to consider in your diagnosis. And I think that should suffice for the diagnosis part. Now, the last thing that I wanted to highlight that might help you, and I've noticed is something that some of my students have do. When you're in the process of describing the symptoms and diagnosing, particularly describing the symptoms, sometimes my clients follow the same kind of headings or the same topics that you usually covered in an intake or psychosocial assessment form. Like sometimes they split up the assignment and describe, well, these are the emotional problems, these are the family problems, these are the educational problems, these are like the history of mental health problems. If you want to do it that way to describe the symptoms and you think it will help you organize your diagnosis better, that is absolutely fine. I really want you to do well in this paper, and whatever helps you organize yourself best, I am okay with that as long as when I read it, it makes sense to me. So keep that in mind that you can also describe the symptoms, maybe using those same categories that we use in intake assessments. If some of you are not familiar with clinical intake assessments and you would like, for me, I think, actually, let me take that back. I put in the midterm, I gave you like a sample. I know I had done that. I gave you like a sample chapter on how to create a case conceptualization, and it gives you a couple of those subheading or titles that we usually cover in an intake. Take a look at that if you're having concerns, but usually what we cover in a clinical intake are like the history of the present illness, right? Or what are the symptoms that the client is manifesting, and if they had been present for a long time, for a short time, when did they start it, for how long have they been present, family history of problems, including physical or mental health problems, interpersonal relations in terms of how the adolescent relates with peers, teachers, family, health problems that the client may have, educational problems, cultural factors. Also, I think in module 1 and 2, I included areas which we normally talk or cover in an interview, in an initial interview with children and adolescents. That can also help you frame your description of the symptoms. Moving on to the third bullet point, the final video that I'll be creating at the end of the month will also be helping you write adequate treatment plans in clinical settings and interventions. So I'm not expecting for this paper for you to maybe do it as well as you will be doing it for the final paper, but I'll make sure for our final video to focus our conversation on that topic. But all I'm going to say is for this one is um, what would you suggest? What would you recommend for this client to work on based on the symptoms or the problems that you're seeing and the diagnosis? What would be your course of action? What are the areas that you will do? Now, in the other video that I will be creating, I will go into details on how to do that accurately. I think to help you, if you want to start working on your midterm, one thing that I'm going to suggest that can help you start organizing this portion, this is where I mentioned that probably you might use a little bit of like outside references, because what I recommend students to do is, well, Professor Diana, this is my diagnosis, and I think we should work on helping the client get a psychiatric evaluation. Um, we should help the client reduce the anxiety symptoms. We should help the client reduce the depressive symptoms. Um, Usually, when we talk about what interventions to use, we have to go to the literature, we have to do a search. You can also use the textbook, you can use my PowerPoint to guide you, but some of you may want to also look out there and see for this diagnosis and for these symptoms, what does the literature says has been done with children and adolescents. So maybe for children and adolescents, it is that have a diagnosis of anxiety, generalized anxiety disorder, the literature recommends this intervention or this intervention or this intervention. You're going to see that in my PowerPoint. I describe a couple of them that you can complement with outside references, and also in the Painter and Scanapico textbook as well. So I want you to kind of borrow from there. Instead of like getting overwhelmed with outside resources for the final exam, you'll be integrating that. For this one, I'm not really requiring it. If you want to, then you may choose one or two outside resources if it makes you feel a little bit more confident about your response. And basically, what I want you to do is maybe tell me one or two goals, and maybe one or two objectives per goals that you want to work with that client, and what kind of interventions would you use to work on those goals and objectives. And that's usually based on the literature. There's sciences out there that is appropriate to treat that diagnosis and those symptoms. I'll get more into the specifics in a separate video. I'll show even examples in the screen on how to do adequate treatment plans and select interventions. So expect that one at the end of February. And then for the final bullet points, we're getting towards the end of this video. What I want you to do is just tell me, who is this treatment plan targeting, right? As you'll see, some of our case studies and working with children and adolescents requires also working with school systems and parents, and that's really inevitable and unavoidable. I think working with children and adolescents is probably quite complex because we have to work with multiple systems at the same time, because children and adolescents are still dependent on quite large amount of external supports in order to meet their developmental milestones and goals. So I want you to let me know what other systems should be included based on the presentation in the case studies. Do you think teachers should be involved in the treatment plan? Do you think parents should be involved in the treatment plan, or anyone else that matters for that case study? Explain who would you include and why do you think it's important to include them, and how would you include them in your treatment plan and intervention. And then I'm going to also ask you to tell me, what are some of the obstacles that you envision For example, I think this is something, remember that first PowerPoint, I think on module 1 or 2, that I talk about risk and protective factors for individual, social, and the community level, or individual, family, and community level. Think a little bit about that. What are some of the obstacles that you think a client described in this case studies might face with the treatment plan and the intervention? Like, if you're noticing that this is a client that may have parents that are not engaged, if you're thinking that they're having issues with social services, or maybe they need some specific health insurance resources or educational resources, those are things that impact engagement and success in treatment for our clients. So think about, when you read the case, what is it that you're seeing or reading in the case study that you think is going to impact your client's ability to successfully complete the kind of treatment goals and objectives that you have selected for them. And I want you to just describe those obstacles. And then finally, just to give ideas or thoughts um, regarding how to work um, with other family members, or I put family members here, but it can also be extended to other important sources of support, which might be hinted to in the case studies. One notion that I include, or not notion, one reason which I include this is because I really want you to think outside the box, in terms of working with children and parents is quite complex, right? You have to balance both of their needs, and sometimes children and adolescent needs are not the same needs as parents, and sometimes you want to support them both. Being a parent, I'm not a parent, but I know from clinical experience of working with many children and families, um, parents do the best that they can with the resources that they have. Oftentimes we shame them and we make them feel bad for the choices that they make. And it's not easy being parent in this complex world in which our children are wired in very specific ways, and they demand so much of us. Their children nowadays are very creative. They're so engaged with the outside world because of media, social media, and other mediums that were not present in the past, and just how our world is changing, that being a parent is not an easy thing. And I just, for those of you who are parents and who also work with children and adolescents, I just want you to know that I see your, like, areas of struggle, and I always get emotional when talking about this, but I just want you to see that I see you, and that I know sometimes it's hard to navigate those issues. And I want you to think, how would you really work with the family in the case study to better engage them, to maybe balance the developmental needs of a parent as an adult and of a child or an adolescent, and what would you suggest to do that? And finally, the last point that I wanted to make is, I always tell my students, please read the rubric and know the worth of each of the sections, because that way you kind of know how to organize yourself and how to prioritize. Obviously, there are some components you can see that are worth more than others. So take a look at that so that you can organize yourself. As a final note, I already saw that you have submitted, almost everyone, your discussion board post. There are almost 32 of you in the class. I'm going to start grading them. Please forgive me, I don't give the most amazing feedback in the discussion board post, but I just want to make sure that I get through everyone, and that everyone at least gets a little bit of encouragement or positive feedback from me. And I'm obviously available for any additional questions that you have. And I'll see you again at the end of February, in which we'll talk about treatment planning and intervention. So I'll see you then. Bye bye.